Gotta make an entrance.
Brian, can you do us?
Yes, sir. So bow with me. Dear Heavenly Father, we thank you for this day, Lord. We thank you for this time of fellowship, Lord. We just ask that you tend to our hearts, Lord, and tend to our minds, Lord, and just fill our vessels with wisdom and kindness and compassion. In Jesus' name we pray. Amen.
Amen. Thank you. Shelley, can you do a roll call, please?
Yes, sir. Jake Webb.
Honey?
Harvey Buzzard. Bill England.
Honey?
Keith Austin.
Here.
Joe Bird. Sean Pittman.
Honey.
Mike Dobbins. Here. Ricky Hargis. Present. Wanda Hatfield.
Honey.
Rex Jordan. Mike Shambaugh. Mary Bakershaw. Ani. Eo Smith.
Here.
Jennifer Taylor. Here. Victoria Vasquez.
Honey.
David Walkingstick. Brian Warner.
Honey.
We have a second.
Thank you. I'd like to ask for approval of minutes.
Make a motion and be approved.
All in favor, say aye.
Aye.
Reports, Marshall Lamb.
I don't have anything new to report right at this time. I'll be glad to take any questions you have.
Mr. Shambaugh.
How are you today?
I'm fine.
Good. I just want to bring something to your attention, something that happened the other day to me. I had called an elder care advocate to give a referral on a person who had a problem, and was told that they couldn't speak to me, that I had to speak to their supervisor. So that just kind of shocked me that, I couldn't give it to the worker. I had to, call the supervisor. But I did call the supervisor. This was 2 weeks ago, and I never had a call back.
The supervisor's in the hospital, but we heard about that. We've addressed the problem. That is not the policy of Human Services. And I think it was a misunderstanding, but we've addressed it with that staff.
Okay. Thank you, ma'am.
Anyone else? Janice Taylor.
Somebody here from child support that can answer a question.
I'm sorry.
Child support, I have a question.
Yeah.
Child support report. Well, I think the report has been cut off because it is talking about Oklahoma Native Assess Coalition resulted in 25 of our clients receiving free $100 children's savings accounts at the National Child Support. And that's where it ends. So I'm wondering.
That is something that we were given an opportunity to do, and chose to give our clients that opportunity to open up a savings account. Some have. Are you saying that it just kind of ended in mid-sentence?
Yes.
Okay, I'll get with her and have her send you what was not typed on it.
Expand on that. Okay, thank you, Marcia. That's all I have.
Yeah.
Any other questions? Thank you, Marcia. Ms. Kitcher?
We have Office of Environmental Health and Engineering staff with us today, so if you have any very specific questions, they're in our audience. We have our 19 budget cycle that we began, and we have our annual appropriations this year. It's going to be much expedient to launch our 2019 projects with an annual appropriation signed from Congress. So also we all have waiting on our 2019 feedback from IHS headquarters on the 2019 projects that's been uploaded to the SDS system. You see the balanced scorecard measures within our reports in terms of the details and the data. If you have any questions there, we'll be happy to answer those. We've made significant progress with our Delaware projects, as you can see. And meeting with potential partnerships in West Siloam Springs, and participated in a site visit with Dr. Beich from Public Health Foundation. There were some positive outcomes that came from that meeting. Our staff from Office of Environmental Health and Engineering has met with them. They established a SWOT analysis and determined to identify the data sets that they would use to improve, where they need to improve and to start a pilot project. We also have our youth development and adult residential program where we had 10 activities with our youth, of which 225 participated in that. We also had 9 adult activities in the month of September where we had 84 adults participating in that program. We've actually launched some of those programs I've been discussing with you and working with the breast cancer and cervical cancer prevention program. This week, they'll be going to Bonita and working with the adults there in promoting breast cancer awareness and education, trying to improve our activities and our numbers there. We also participated with our veterans program in the month of September. A large number of our community staff participated in that project, and it was a fun activity there in the month of September. We have 8 activities going on in the month of October with our youth and 9 adults in the month of October. So we're spread out across about 7 different counties right now and providing those services, cultural activities, and tradition. So is there any questions that you may have regarding the report that you've been provided?
Harley.
There was a report last month, Ms. Ketcher,
Uh-huh.
concerning the Indian Health Service rating system on the SDS system, and I can't remember the criteria about it, but it seemed to me like they weren't going to rate some of our projects as they used to rate them.
There was a policy revision that was out for consultation, which Billy here was a part of, wrote our comments in response to that policy revision, where the priorities would be re-ranked according to different criteria. Billy, do you have anything to add to that?
Yeah, hardly. Basically, the headquarters came out with a new interpretation of the public law that guides our program, specifically what they consider deficiency level 4 and 3 system homes. So a home that has water that we would consider unsafe was formerly considered a DL4 home. Under their new guidance, that's a deficiency level 3 home. So we had to re-rank our projects and rescore them according to the new criteria that we got from headquarters, and they put out a request for consultation on that guidance, and we've replied to that, basically expressing our displeasure with that new guidance.
Wonder what kind of numbers, is it going to make a big difference in a number on deficiency 4 homes?
It is going to make, as far as the total number of homes that we have that dropped from deficiency level 4 to deficiency level 3, I could run a report for you and get you some specific numbers on what the effects were before and after.
Yeah, can you tell us what the difference was between a DL3 and DL4 as it was yesterday or last month?
Well, under the previous guidance, a deficiency level 4 home was a home that had access to no water, or the water that they had access to was considered unsafe.
Okay.
And so under the new guidance, a deficiency level 4 home is basically a home that has no water. And a home that has unsafe water has been re-ranked as a deficiency level 3. Mm-hmm.
Okay, well, hopefully that your statements that you put in may have some effects on it. Does this affect all Indian Health Service?
Yes,
facilities?
this was for tribes nationwide,
Okay.
and from working with the other tribes within the state and also within the National Self-Governance Coalition, we pretty much were all in agreement about the old deficiency level scoring criteria, and that we all agreed that was probably more in line with what the actual intent of the public law was, and that the new interpretation was not favorable to us, and we were not in favor of the new rankings.
Do you anticipate, if you're getting the same increase on your admin money as you got last year?
It's too early to tell.
Too early.
We don't know. The House Appropriations Committee put in the same amount as they did for FY18 for the FY19 budget, but we don't know. I don't believe it's gone to the Senate yet or through that process.
Great if you do.
Yes, it will be.
Thank you, Mr. Chair. Thank you.
You're welcome. Sean Griffin.
Billy, so now you help the level 4, right?
We help all of them. Where this makes a difference is when we submit projects to Indian Health Service, the projects are ranked according to several scoring factors, and the deficiency level of the home is one of the factors. So a deficiency level 4 home, we can apply for more money to correct the issues.
The big picture money, right?
Yes,
No.
yes, sir. Yes.
All right. Thank you.
You're welcome. Anyone else?
Thank you.
Mr. Cooper.
Yes, sir. So good afternoon, everyone. I know you've had a long day, so I will try to do my best to keep it short. I have some notes from several of y'all that I met in between the meetings that had some questions that I will get to and get back to you on. One thing that I wanted to be sure to report is our HUD Bash program. They put out some information for us to renew the project, and we've turned that in, and we got confirmation right before the beginning of the new fiscal year, so it was right around the end of September that we were renewed for that demonstration project. So that is moving forward. Just on the upside of things, the Senate passed out a bill that would fully authorize that program. It sits over in the House, so maybe whenever they come back during their lame duck session, hopefully maybe they will pass that, and that would fully authorize that program. It's currently set up as a demonstration project. We've demonstrated the need exists in Indian country, that there are veterans that have been able to not be housed through the regular HUD VASH program that are tribal citizens. We've shown that there's a need, so we have also on the demonstration project, one of the reasons they did some renewals is so they could see how many vacant spots they might have outside of those that are participating. So they will put out some more through a competitive process for folks to apply for. Right now, if everyone who is looking for housing, who we're currently working with the VA to find housing for, find something, we will be fully housed on that program. So that's 20 veterans who were homeless now have homes. So right now we're at, I think at the end, at this reporting period, it was 15 and we had 5 out. So I think some of those are have found something now. So that's always a good thing. Anytime we can house anyone, it's a good thing, especially something good whenever it's veterans. I think that's the main thing I wanted to report. The other thing is HUD programs are still continuing to operate under a continuing resolution. The T-HUD appropriations bill was part of the ones that were in the continuing resolution through December 7th. So those programs are part of that. We still are looking for the ICDBG grant program to be hopefully a notice be coming out sometime between now and the end of the calendar year. We expected it a lot sooner, but it hadn't happened yet, so we're still continuing to work on that, and HUD tells us that they hope to have it out in December. Other than that, I think that's all one other thing that I do want to mention is we've just finalized the last students for the college housing program. I'll be able to have you final numbers next month, but we're right at 123 students that will get housing assistance to help them. And these are NAHASD eligible students, so they're income eligible, their families are income eligible. It's students that, you know, if they weren't able to get the housing assistance, which is $1,000 a semester, might not be able to do something. So we're really proud of that, and I think since we reinstituted that program back in, I think it was 2011, we've been able to assist between 800 and 900 students. So that's something that we're proud of over in our office. Other than that, I'll answer any questions that you might have.
I just have a comment. After our last meeting, I think Councilor Hatfield and I had maybe 3 or 4 day notice. we were invited to go to Washington DC with Gary and with Secretary Hoskin and our government relations, Kim Teehee. And I want to tell you right now to lobby for more funding to expand our demographics into Arkansas. And that's what we were campaigning on. There's a lot more to that than that, and I could probably talk for an hour on it, but I won't do that. But what I do want to say is how well prepared these people represented us. We went to the senators in Arkansas, we went to the representatives, Mark Wayne's office, but everything was so organized and it was so well done. I was just so proud to even be a part of it and to be there. And I just want you to know, I think we're very well represented in this capacity. And kudos to you, Gary.
Thank you, ma'am.
Anyone else?
And I'll be around just in case y'all have some questions that come up.
Thank you. Michael Lynn.
Making a lot of noise back there. Good afternoon. I'll keep my report brief. Just update you on some of our active construction projects and things we've got coming online fairly quick. Leach Kenwood Road in Delaware County, the shoulder was completed a couple of weeks ago. Still waiting on sod, guardrail, fence, signs and stripes, and then there's about 200-foot section of asphalt that had failed testing that the contractor will be replacing there. It's on the north end of the northern portion of the project. Honey Hill Road, I reported last month that we were waiting on vegetation in order to get the project finalized out. In the midst of waiting on the vegetation, the grass and such, in order to final it out, we've noticed a failure going up the hill there towards the top of towards the Honey Hill Church. We've been dealing with the contractor. They're willing to come in and fix it and repair it. So we're working with them on that. As soon as the weather clears up and gets a little bit warmer, they'll come in and saw cut that out and patch it and replace the subgrade there where it's failing. Northeast Fort Gibson project crosses here between Cherokee County and Muskogee County. We've got a bid opening on that on the 23rd of this month. Had a pre-bid meeting earlier in the month and had a huge turnout of contractors. I think there's about 12, 13 contractors that showed up, contractors and suppliers that showed up for the pre-bid. So that was a good turnout. Anticipated good results on bids there. Hulbert Lost City, Grace Hudlin Road. We've requested final utility plans from all the utility companies, so we can begin utility relocation on there. We're making final changes to the plans to send to the engineer for final review and sign off. Ross Street Road here in City of Tahlequah, utility relocation's underway on all utilities. We have had what I'm going to call a last-minute request from the City of Tahlequah on a potential pedestrian crossing across US 62 there between East Ross and West Ross. Right now, there's no pedestrian crossings there. ODOT, that's ultimately ODOT's. They'll have to approve all of that. They have the final say in what happens on that highway. So we've got the engineer looking into that, and we've got a conceptual design for a pedestrian crossing there, but that would require not just painting on their street, on the highway there. It would also include the signs, the push buttons in the signs, and reconfiguration really of all of the signal lights there. So that's in ODOT's court right now. We're waiting to hear back from them, and if it's something that we can work out and get in the plans timely before we're ready to bid it, we want to do that so that we can get that in there. So, and last thing I want to mention is we call it North-South 4410, or also it's a Turnpike Bridge project in Craig County. Right-of-way is underway. Right-of-way acquisition is underway. That project leads outside the city of Veneta into the clinic up there, east of Veneta, northeast of Veneta, I guess. And right-of-way is underway on that, and we are reviewing counter offers right now. So, Mr. Chair, that is all I had to report, and I'll be glad to answer any questions.
Thank you. Any questions?
I have one.
Yes, sir.
Are we doing anything, the Cherokee Nation on Mud Valley Road?
Yes.
That is our project?
That is our project.
Okay, what is, how far, how long is that?
The length of the
The
project?
length of that project?
It'll go from, I don't know the exact mileage, but it'll go from this highway there at 4th Street, I believe that's Bypass and 4th Street, west all the way to Coos Thompson Road.
I had a call last night, they were jumping up with joy about that project.
We've got
School
60
kids, a lot of places there where it wasn't appropriate for a bus to pick up the kids and so forth, so, good.
Yeah, we've got
You get
6.
with,
Sorry.
our county commissioner, the one, I said,
I've got some stuff to talk to you about after the meeting.
okay.
Yes, I did talk to him this week, Commissioner Hubbard.
Welcome. Anyone else? Thank you, Mike.
Thank you.
Anna Knight.
Good afternoon. Hey, Anna.
You have a copy of my report, and I can either look at my report or look at your faces, one or the other. But I am happy to answer any questions that you might have.
Any questions? That report was good.
That was such a good report.
Thank you.
Nikki Baker Lamore.
I know we're running behind on time, but I did pass out just a little packet there of recruitment cards, just something cute to put in your wallet, your purse, or something, and help out just whenever you can. We currently have about, I asked for the exact number, but I don't have it. We had to remove 8 children about 3 days ago, so that was a challenge trying to get them all placed. But we currently have around 95 children just in Cherokee Nation's custody. So that's a lot to juggle on a daily basis. Like I said, we're solely responsible in our own Cherokee Nation foster home, so that's what we've got. But other than that, you've got my report, so any questions as to August's numbers or reports, or the report, I'd be glad to answer.
Questions? Frankie?
I don't have a question, but I just want to say thank you to you and Charla and whomever else helped with the young man in the Okmulgee that I called you on a couple weeks ago.
Okay.
He's back with his aunt and the family, and we just appreciate your help.
Regarding the eligibility notices, that's something that just sticks out to me. And
Sure.
Number one, it's a shame there are so many children in need, but I think I talked to you about your average response time a few months ago, and it is greatly reduced. So
Yes.
good job, your staff is getting after it.
Yep, we're fully staffed. And I noticed that too. I was like, 22, woo-hoo.
Yeah, that's
So, yeah, because
amazing.
we were up to 45 and 60, but again, depends on how many notices we're getting. We have no exact amount. It's constant. It just fluctuates. And then also if we have enough staff, and then we did get the new database, and it just took a while for them to.
22 days is quick.
Yeah, thank you.
Go ahead.
Wanda?
I was basically just going to commend you on your report. I like, when you break this down, break everything down, make it simple, for me to understand. And we have all the data, we get a lot of the data, but I wanted to thank you for the report. It's good, thank you.
Mr. Shambaugh?
Sure. Do you see without opening a can of worms, do you see the decision in Texas by the judge ruling against Indian child welfare? Do you see that having an effect here? Or
No, I
that's
don't.
not overturned? That's just a separate deal, or?
Now, does it have an effect on Indian child welfare? Absolutely. Of course, just Texas and those states within that circuit are affected right now. And I know the AG's office was going to stay and speak if that possibly came up. But so I'll be brief in a sense that they like to handle the legal issues. But absolutely, it's very serious, and we should take it very serious because it could affect our sovereignty in so many other areas.
That's what I was reading here.
Yes, it's very serious. But do I have a strong faith that the Indian Child Welfare Act will prevail? I absolutely do. But it's something to take very serious.
Elena?
That's
I'm
correct.
always afraid to see 2 lawyers at once come up. Come ahead, young lady.
This topic needs special attention from this council, and it's already really close to 5, and I would hope that we could get more time to talk with you about this, if we could put it on rules or have a discussion on rules about this case. And I'd be happy to tell you from beginning to end about this case, if that's okay with this council.
That'd be fine.
Thank you.
Thank you. David, did you have a question?
Yes. How's the work situation going since last month? Has things gotten better?
I believe most of that was a disgruntled employee or two, And so, again, it's just business as usual. I haven't necessarily changed anything, looked into some of the concerns that were mentioned in the emails, but a lot of the information was not true. So I have nothing more to add than it's business as usual, and we're doing great. I did get you the turnover rate, which was 11%. Provided you an article to show you that's actually a healthy turnover rate.
Okay. The McIntosh home there in Telholt. So you mentioned last month that if there was a certain number of kids that went into this home, it wouldn't be considered a group home. Is that correct? Because you guys are trying to stay. You guys don't want to be considered a group home. You want to be considered something like it's not a group home though, right?
No, it would be illegal to have a group home. There's also a new act called the Family First Act that's coming out, and they actually are starting to limit all foster homes to up to 6 children. So in the beginning, the nation could deviate all the way up to 12 and still be allowed to pay that foster parent. But because of this new act coming out, we actually will also be limited in the amount of the children that we can place in that home. And that's something that I'm working on this month and next, just to get creative. Does that mean the top floor might have an extra parent and the bottom floor? So I don't know what that's going to look like beyond that. I will put as many children in that home as I can legally and safely, and follow all policy and procedures that the federal government sets out in regards to regulations and funding.
Can group homes be funded by the state?
That is a question probably beyond my expertise. I would have to go to some of our partners and ask that. So your specific question is just, could Cherokee Nation open a group home? Is that what you're wanting to know?
And get funded by the state before you.
Off the hip, my answer is no, but I would have to ask some of my girls that work in that every day.
Okay. So if we're operating outside of a group home, then are we receiving any funding from the state, or are we just self-funding this ourselves?
Are you talking about the McIntosh home?
Correct.
The McIntosh home actually isn't receiving anything in regards to payment for foster children. It is, well, it is a foster family that's currently already certified with Cherokee Nation and the state of Oklahoma, then I'm going to move into that home. And so we, as a tribe, go and look at the home, make sure it's safe, there's no exposed wires, et cetera, and we certify that they can live in that home. Because you don't have to own the home, anything of that nature. It's, can you take care of children in that house? And so they're already certified. They'll move into that home. We'll go check that home out. As soon as it passes, we pay them directly. It has nothing to do with the McIntosh home.
We, as in the Cherokee
Nation. It's called a pass-through. Okay. It's Title 4E, which allows for foster care payments. We pass through the state. The state pays that. About 2 years ago, we wrote a grant, and it was a planning grant for 2 years. We're going to roll out and do our own Title 4E certification in about January, which is a huge step towards sovereignty, and we won't even ask the state for any assistance. We will be able to pay our own foster parents as a nation. And so to me, it's a huge step. The Chickasaws are currently the only tribe of our 5 that are doing it. The Choctaws, after we've stepped forward and done it, are following, and then along with the Creeks. So it's something that, of course, is in tribe's best interest. It brings lots of extra funding into child welfare. So again, I could go on forever about Title 4E and the perks and benefits, but that's just kind of a taste to answer your question.
It's interesting. Well, that was my question. I just want to be sure. What was the definition of a group home, what that number is, and this Title 4E that you're talking about, it doesn't fund group homes, but if you stay outside of the group home definition, then we'll be able to tap into these Title 4 monies. Is that kind of what you're saying, or?
No, like a group home to me is like your Moreau home and your Oaks Mission home, and we do use those facilities, but those require 24-hour care. I mean, all kinds of rules and regulations and certifications, and I don't see how the nation could ever open up one of those, but that doesn't mean that I can't look into that for you, let you know possibilities and things of that nature, but I don't think that we're able to, but again, I need to go back and look and see why that is and provide you why.
Okay. All right. Thank you. Thank you, Chair.
Mr. Shambaugh? Good. Anyone else? Thank you. Rob Doherty.
Yo. We have a couple of quick announcements, but any questions on the report?
On the click though?
Don't know. Couple of quick announcements. Some of the communities, a couple of communities asked me to make announcement. Greasy communities having on Saturdays, they're having some kind of a, I think it's a maze, corn maze in their ball field and stuff, and they're asking everybody to come out. Ask the council to come out as well. And then they're having, I think, Halloween night, children's night or something. And another community asked me to do the same thing was Oak Hill Piney up in Delaware County. October 28th on a Sunday, they're having a stickball game up there. So everybody's invited to come. They're even having the older guys like us who want to play. And October 31st, they're having a children's night, Halloween. And then November 12th on a Monday, the Veterans Day, they're having a big dinner up there as usual. They're inviting not just veterans, but everybody. Well, those are the only two. Another one is for your constituents and communities, the COTA grants that this department awards. They're due by October 26th, and that's a week from Friday. So if you have a community meeting coming up, let them know. We have by close of business on the 26th for the COTA grants. So, and a lot of the communities within the 14 counties do that. So. It's good in the gaunt. That's all I had.
Any questions?
What else? Is there a lady to say?
Have a community meeting this Thursday evening, 5:30. So you bring some of your crew if you want to come. Here at Tahlequah.
Here in Tahlequah?
District 1, 2, and 3.
The community building again?
Yeah.
Okay.
And our good Mickey Spears, 5-star chef, is providing the
Going in. All right, I'll spread that around.
Instead of the 4S, we got the 3S.
Oh, yeah, that's right. We had that group there.
You're not disappearing, are you?
I'm sorry?
You're not disappearing, are you?
Not really.
Okay, I just want to talk to you after.
Oh, okay, all right. I can if you want me to. All right, what else?
Bar performance.
Good afternoon, council.
Barbara.
Okay, so I've got my report. Do you have any questions?
Any questions?
You have a comment?
Yes, sir.
Barbara, the last couple of years you've been over at the Veterans Building, I've really seen an increase of participation, and I think that goes with your creativity, thinking outside the box of creating events and bingo nights and the warrior flights and all those different things. You've really done a great job with that program, especially being short-staffed. So thank you for what you do over there. You really elevated our program with our Veterans Affairs. So I thank you for that.
Thank you, Councilman.
Thank you, Chair.
You're welcome.
Appreciate it.
Mary Shaw.
Yes, Barbara, I want to say that I can't believe you didn't put Warrior Flight in bold on this. You know, Councilor Hatfield and I were in Washington, D.C. On the House Bill 184, HUD 184, and we had a window of opportunity to go and watch the Warrior Flight and watch the chief, our Secretary of State, Chief of Staff, and Secretary Hoskins lay a wreath at the Tomb of the Unknown Soldier, Cherokee Nation wreath. And I'm going to tell you something. Just from what I saw that she had arranged and organized, it was outstanding. I mean, it was one of those moments where you had to hold back the tears of how meaningful it was. But what I saw, we also ran into them at the Capitol. I'm gonna tell you what, you should explain what you do on these flights, because I was just amazed. And I think Counselor Austin actually attended this, maybe he might even.
Counselor Smith.
And Counselor Smith, that's right. And I'm just gonna say, you should have had this involved. This was amazing what you did. And I don't think anybody understood. You had this, she had this outline, and she had it scheduled. We're talking 24 hours, what, how many days? 3? 3 days. I mean, and everything was just first class, first rate, and you'd be very proud, and thank you. It was amazing.
Thank you for that. I can't take just full credit for that, though. I have a lot of good people working with me, and some from the administration assisted with that. I know Adam McCreary helped with the time and everything, and Kim Teehee. So I have to give credit where credit is due to all and my staff. It's a lot of planning. It's a wonderful trip, though. It's different every time. And I would encourage the ones that haven't went. It's a trip of a lifetime for you, too. So I would encourage you to go at any time.
Real briefly, I want to share one of the experiences from that trip. We were on, the veterans were phenomenal. Just being with them as they experienced Washington, D.C. was phenomenal. And as they experienced the honor. We were at the gate of Arlington in the bus waiting for our time to enter with the veterans on the bus, and we had a group of our awardees who actually were Cherokee speakers and Cherokee singers, and their spouses. Several of those were Cherokee singers as well, and somebody made mention of, well, why don't we sing a song while we're waiting at the gates of Arlington? And they impromptu start singing Cherokee hymns in the Cherokee language at the gate of Arlington. It was one of the most touching things I've ever observed in my lifetime, to see this group of honored men and their loved ones singing hymns in Cherokee at the gates of Arlington Cemetery. I was fortunate enough to be able to record 30 seconds of it and posted that on Facebook, and it has, according to Facebook's numbers, it's been viewed by 19,000 people, because that's the number of people who saw it and spread it and said, you've got to see this. And
I think I watched that over 3 times.
you counted a little, did you?
Yes.
Yeah. Well, if you saw it, you said, you've got to see this, and shared it with somebody, didn't you? And that's what I think happened there. But it was an honor to be there. And I encourage everybody to do that at some point in their term of office.
Junior?
I was going to say something about it, but he's already said it. What amazed me the most was every one of them you talked to had a great story. You thought, well, man, this is the story of the trip. And the next guy you talked to could beat it. And it was the biggest, best trip I've ever been on, non-sports related. It was great. but every one of them was, and they're sharp. They're sharp, and they've all done good. And they all had people on the wall and stuff like that. It was really great. And she did a great job.
Mary and the other counselors have also said just what I'd like to say, but thank you. It is probably one of those profound events that I don't know if you call it an event, but a thing that I've ever attended. It's so heartfelt, and the veterans are so awesome. They were just, and so and Mary and I were lucky. We just happened to be there, when you were there, and I want to thank you. You did. It was great. I mean, it just seemed everything went smoothly, and the veterans are very appreciative. They mentioned several times, the counselors that were there, and so that makes you feel needed too, brother. Thank you.
And I want to thank you all also because, you put the money in the budgets for us to have that, for us to have it every year. So I had to say thank you for that, or it couldn't be possible without you and the administration doing that for us.
the trips are completely different. The one thing I might add that you don't really get to see till the end is when we got back to, well, on our way to the airport, we had all the fire departments and the police stations escort. We had the Patriot Riders escort all the way to Bentonville, all the way to the airport. And at one point, one of the fire departments, there was a bridge that we went over, and they had their people hang the flag over the edge of the bridge for our veterans. And so it's these special things that people don't see. And when we got back to the airport and we were on our way back, and then we get to West Siloam, it's hard to say bye to the veterans. It's hard to tell them goodbye because you've been with them for those 3 days, solid 3 days. And there's a lot of hugging going on, I have to say, because I think I've hugged every veteran's assistant, our council. Those are the things that when you go, and I appreciate Mr. Austin and Mr. Smith for going through the full route of the trip. Because they can say now, you know, especially to their constituents too, that they have been, you know, on this. But it's a wonderful trip. I'd be glad to talk to any of you in detail about it any time. I think that for our Christmas program that's coming up, we're going to try to invite all of the past Warrior Flight recipients that we still have with us. And I think we need to do that from this point on because we're losing our older ones that first went on these trips. And I tell you what, they love to come back to the Cherokee Nation. And even I went to the Elder Summit in Claremore, and we recognized some of the veterans there. They still have those vests that they got on the Warrior Flight and those caps, and they're still very proud of that. So I think it's not just me that can be proud, it's all of us that can be proud of that event.
Thank you. Thank you, Barbara.
If there's no questions, I have a couple announcements.
You bet.
Okay, so on November the 9th at 9 o'clock, we are going to have our Veterans Appreciation Day. We'll be laying the wreaths there. We'll have resources, and we're going to have cultural activities. And we will be providing lunch for our veterans and their families. Let me see. On December 22nd, we're planning some type of Christmas program. We'll probably be starting in the afternoon towards evening. And I would invite all of you to come. I will have the agenda out probably tomorrow for November 9th's event, and then we're working on the 21st to finalize some of that. I do want you to know that the Choctaws have contacted us. I've talked with them probably 4 times now, and they want to do the Warrior Flight. So they are very interested in that. So we can be proud of that also. I'd like to say a couple of thank yous. I'd like to say thank you to Martha Ketcher and her community services group for coming and volunteering. The employees volunteered to do our veteran food outreach that we had this last time. And also I got to put a plug in for Job Corps. Job Corps sends 10 to 12 students to come and help us on that event. And it takes, about 30 people really to do that event. So we're very happy when a program volunteers and lets us have some other people helping us that day. And of course, I said I'd like to thank EO and Keith for our councilmen there for being with us through the full trip. It was a blessing to have you all with us too. We're going to have bingo again on the 18th, and risk management and facilities is sponsoring that for us.
Barb, make sure you share those with Gail so she can distribute those out.
I will, Council.
Okay.
Bingo nights too.
And
Bingo
thank
nights.
you.
Okay. I try to get it all to you.
Appreciate you.
All right, I got a couple announcements.
Yes, sir.
Thank you.
We have a meal ready for council members, and we have a 5:30 reception for the 3A state girls softball champions. They'll be waiting on us there by the council
So
chamber.
you have 7 minutes.
Is that it?
Yeah, no, your supper's waiting.
Motion to adjourn.
Motion to adjourn.